All right, I think we might get started. As I said, I'm really mindful and respectful of the people who have joined us this evening. So I'm sure it's getting home from work or getting dinner and getting children organised. So it's great that you've really joined us this evening. I'm going to start off with an acknowledgement of country. So I would like to begin by acknowledging the traditional custodians of the land we're all meeting on today, and I repay my respects to their elders past and present. I also acknowledge my gratitude that we share this land today, my sorrow for some of the costs of that sharing, and my hope and belief that we can move to a place of equity, justice, and partnership together. So let's move on to the next. So today we're going to be looking at fostering, and we'll start off with looking at about who we are at Life Without Barriers. We'll talk about, in general terms, about fostering, so you can make an informed decision on moving forward. We'll talk about children in care and why they come into care, and what the journey is like for them. And then we'll talk through the process of becoming a carer, so the steps that are involved through Life Without Barriers. We'll also cover some common questions that come up quite frequently. So we ask as I go through this presentation with you, if you can pop any questions that come up for you, if you pop them in the chat. Louise, who's our fabulous care engagement officer, very blessed to have her. She'll monitor the chat room, and if she sees there's a number of questions in there that we haven't covered, we'll definitely cover them at the end. So who is Life Without Barriers? So Life Without Barriers is a leading national organisation, so we're in every state, with social purpose organisation established close to about 30 years ago by a determined group of members with a clear vision to partner with people to improve their lives for the better. We provide people with the services and assistance they need so they can achieve their goals and maximise their opportunities to participate as fully in society as they wish. We partner with communities, elders, government and the private sector to ensure we can achieve positive long-term change in the lives of people we work with. We work with over 23,000 people in over 400 communities. So we support people through providing a range of services, including foster care, disability support, aged care, mental health, refugee and asylum seekers, homelessness, and many more. We really like to think that we tackle social issues head on. So in terms of how we function, we really look at, people are really important, and it's more important in what we, I suppose our actions are more important by not just what we say, even though we make very strong statements. And we also have them entrenched in our values as a professional organisation. And we work together to deliver our services through demonstrating these relationships. Or these values, sorry. So for us, we build relationships. So we are people too. Relationships for us comes first, and embedded in developing really strong, healthy relationships is really good listening, which helps us to understand what people want and what they want to achieve. We are imaginative in our thinking, and we're open to new ideas and ways of doing things. We don't have all the answers. Sometimes people like to think they do when they have our own professions, but we don't. Sometimes creative thinking comes from all different areas. We're respectful and caring in our dealings. We like to see the big picture, but never lose sight of the small detail. We also welcome diversity. We're responsive to needs, so we're not just about, like I said, just having blurbs and saying what we do. We are very committed to responsive to needs that people identify and determined to get things done and do them well. We're very courageous in our convictions and we stand up for what we believe in. So what is foster care? So basically, foster care is a service provided to children and young people who cannot safely live at home with their families, either in the short term or in the long term, which is usually up until about 18. So the Child Protection Department in Victoria is the body that is solely responsible for identifying children and young people who are at risk if they're to remain with their family. And together with the family court system, they may decide that children are best placed in foster care due to, as support cannot be provided if they were to remain at home. The first goal of fostering or foster care, of having a child in foster care, is to always work towards returning the child home. So everything is about that reunification process. And where it's not possible, that's where foster carers provide that safe and secure, stable home so that children who have suffered harm can grow, heal and thrive. We're always looking for more people to open their hearts and fostering all these young people that keep coming in. So you might have heard about fostering, talked about foster care, out-of-home care, family-based care. So there's nearly 50,000 children at any one time in Australia who can't live safely at home. So the need is great, never ending. I'd like to think working in this sector that I'm a change agent and we will never have to bring kids into care and we will never need foster carers, but we're not there yet. So why do children come into care? So they come into care for a myriad of reasons. Mainly it's around experiencing some kind of trauma, abuse related to a number of complex and family situations. So some children that enter care may have experienced or witnessed domestic violence within their family. We know from statistics that are overwhelming reason children enter into care is due to neglect. Linked in with parents not having the capacity to meet the needs of their child and provide a safe environment. Social issues like poverty and lack of support system for parents are key contributors to this. So hence why it's such a significant area of need. Another common reason for children needing to spend time in foster care can be around parental mental health conditions. And I always add in drug addiction as well. So maybe for a period of time that a parent's mental health may become unstable and they may need time in a psychiatric ward. Again, with parents with drug addictions, they may need to spend time in a rehabilitation to address their drug condition. So at that point in time, and because they don't have great social support networks, family and friends, the child may need to come into care because the parents obviously have to go off and deal with their own issues so that they can provide a safe home in the long term. Another reason why children come into care is parental death. And that's where, obviously know what death is, but where no family, no extended family has been able to be identified by the department to provide that adequate care. And other times when children come into care is that they may have such significant needs that a parent is unable to meet that need and it requires a specialist approach to provide that need. So there's a myriad of reasons why they come into care. No two child is the same in that space or with their experiences. So who are the children who come into care? So they're aged between 0 to 17. So 18 is the legal age in our community around legality, becoming an adult. So hence why it finishes at 17. They may also come into care within a sibling group who also need to live whenever, need a space to live. We like to keep sibling groups together, but we know that can be hard. Within Life Without Barriers, we try to make a real strong effort that if siblings do have to be separated, they can be remained with Life Without Barriers carers so that all those connections and visits can happen easily. Children coming into care come from a variety of cultural and linguistic backgrounds. Some are newly arrived families who've experienced trauma due to war. Others come from cultural backgrounds that are well established in Australia. And whenever we can, we like to match children from cultural and linguistic backgrounds with carers who have the same kind of identity. So if they share language, rituals, faith. Of course, if this is not always possible, as it not always is, we need to have carers who ensure that children will remain connected to their culture and their identity. This is really important in terms of our history with First Nations people. We know that First Nations children are overrepresented in the child protection system, 10 times more likely to be involved with the child protection system than non-Indigenous people. We also have an Aboriginal placement principle that's enshrined in legislation that says that children who identify as First Nations be placed within their country and within their community. So the first is always to place them with Aboriginal carers. At times that's not always possible. So we do look at enhancing foster carers to be able to care for an Aboriginal child, which is about really that, that cultural competency, really repairing the past hurts and policies that caused a lot of pain for people. The other thing that's really important for children in care is that they are connected to family. So their families, regardless of whatever they've done or haven't done, so actions or inactions, they will always be important to them. So like what I talked a bit earlier about, the first goal of a child coming into care is always to see if we can reunify and get them back home as soon as possible. Regardless of court orders or decision-making by the department, children's parents, siblings and other family members always need to be involved in their care and respected by our carers. So the department is always the decision makers in how much involvement carers need to be with parents. But it's about building those strong relationships and maintaining those connections. And those decisions are always made in the best interest of children. As I said before, whenever it's safe, it's always best children get back home to their families of origin. So we need carers who can really support that reunification process and partnership with Life Without Barriers and the children's families. I mean, it's always even good, even if there's no contact with families, that carers really support children to be able to talk positively about their family. You know, you keep the memories alive. I still have memories of my childhood. So it's really good that we're able to have carers who can support children to keep those, especially those positive memories alive. So children in care have all suffered trauma of some sort. We can say that quite safely by just the mere fact that they've had to be removed from their families would have caused trauma, just based on feelings of separation, loss and grief, and being away from family, however terrible they might have been in terms of their actions or inactions. They're familiar. Their home is somewhere that they've known. So it's really hard at times with that loss for children to manage. So they require a lot of support from carers, from the adults around them. Because of being removed or because of the trauma abuse within their family of origin, they may have lost connection with family, friends, school, sports. So they need a safe environment to be able to express those feelings of loss. And sometimes they're not always going to express those feelings with words. At the end of the day, children in care are ordinary kids. They have had out of ordinary experiences, so it's a very small percentage of our population that come into the view of the department. They still have hopes, dreams, aspirations like every other child that we know and love and have experienced. So the different types of care. So when you're considering being a foster care, it's really good to have a sense of what are the different types of foster care that's available. So you'll see on the screen, so respite, emergency care, short-term and long-term care are generally the ones that we look at. So respite is usually planned. It's typically weekends, school holidays, for up to about 7 days. We like to plan it with what we call the full-time carers, the primary carers. So it helps them to have a break so that they can maintain the child in their home. The other great thing for the child is that it enables them to expand their network of safe, trustworthy adults. So in terms of their family of origin, whatever happened to them, adults were not always trustworthy. So it's really important they get that sense. Any respite arrangements will always be made in the best interest of the child first. Emergency care is when a child needs someone to stay immediately. The call may come for an emergency foster care at any hour of the day or night. It's usually up to a 4-week period. So emergency care is really good for when the department has had to immediately remove a child and they need time to, one, gather information and evidence to say, is it safe for the child to go home? Or do they need to stay in care? The other great thing about emergency care in the best interest of the child, it allows the department to try and locate extended family members who could be kinship carers. So even though it can be up to 4 weeks, it could be within 2 weeks, they might have found an aunt, an uncle, a grandparent. And we know for those family connections, it'd be great if we have kin that can do that. The other type of emergency care is if a primary or full-time foster carer becomes unwell suddenly or has an unexpected emergency within their family. So we may have to ask for emergency carers to look after those children. Sometimes it's going off for a funeral. Sometimes it's visiting a sick relative interstate. So it's really good if we can help out our full-time carers that. So short-term care, often one difficult situation. So short-term care is around 6-month period. It can go for longer, depending on what the department decides in conjunction with the courts. So the primary purpose of short-term care is really to look at supporting parents to address whatever their issues are that brought their children into care. So I talked earlier about if they've had a mental health issue and they've had to attend hospital to get their mental health stabilized again, if they need to go off to drug rehabilitation, and once they get that under control, they can look to have their children back home. It needs to have carers who can really provide that safe and stable home for children, because it's also a period of time for children to look at healing and thriving. So the trauma that they may experience, they may need specialist appointments, such as therapy, it may be OT, it may be speech. They may not have had their dental issues addressed. So it can be a lot of those getting the child back on the right track. Long-term care is over for 6 months. It's longer than 6 months, obviously. It's really committed to supporting a child into adulthood. So it really looks at going up to 18. That, stability, staying in one place, one home, one foster care is really great at helping them heal and thrive. If you come along and join us on your journey and get to go training, you get to hear a great foster carer has been doing fostering for 10 years. And because of the long term and the association, she still catches up with young people who are now parents themselves and doing really well and thriving. And that's down to this carer and her husband. It does not necessarily mean forever, because the same time they still could be reunified. So even if a child comes into your home at say 10, by 15, there is a possibility that they could go back home. That's the powers that be in the department to decide in the best interest along with the courts. But sometimes it takes parents a few years to turn things around. And we always need to give that opportunity to get back home. So what is our approach to foster care? So basically, where am I up to? I'm trying to read from 2 different screens. It's going to be great fun. So really how we operate is needs to be for us evidence-based to guide us in how best to operate, how to interact, how to remain really child-focused is really important, so keeps us in check. So we look at we've implemented this evidence-based informed therapeutic model of care that came from Cornell University in the States. And it's got 6 guiding principles, but it's called CARE. So it's really about creating conditions for change. So you see the 6 that are there. Like I said, we use CARE to really guide how we work with children and their families. We also use it to how we guide and work with our foster carers, with our staff. It's kind of to be at the core of how we operate, and how we get measured is really important. So it really focuses on our relationships to really build new competency and guide our interactions with children and their families. It helps us to make decisions and takes actions based on the best interests of children. It also emphasizes that everybody does well if they can, and by working together, we can create conditions for positive change in the lives of children. It helps us to have a shared language and an understanding, and so we can be consistent in our practice and work towards a common goal. So it's a really great model, I think. I may be a bit biased. So the next that we look at is what's the most important role of a foster care. So there's 3 different video clips. We can't play them through technology. I don't know why. That's okay. I don't need to understand it. But the links are going to be shared with you in the chat, but also in a follow-up email. Strongly encourage you to have a look at them. They're only, a few minutes long, 2-3 minutes. So might be good that you hear from people who have their own real experiences, instead of just listen to me. Okay, what do we look for in carers? So attributes of a great carer. So I suppose children in care have usually had really tough experiences in their lives at such a young age, and they really need help in understanding those experiences and moving through them. Sometimes the experiences mean that they really haven't learned to understand and express their feelings, and the only way they let it out is through their behaviours. Kids in care really need special people to be able to provide them from a safe place for them to be able to work through their pain. We know that great carers have some great carers that we look for. It's beliefs in the way of being, and values that make them open, accepting and stable people for these young people to lean on. We know that great carers are resilient and able to weather the storm that hard days bring, and fostering can be very challenging. Sitting with a young person who really can't express what pain is like for them can be really exhausting. But we know with the hard days and sticking with young people, there's great opportunities to celebrate the joys of the small wins. At the end of the day, for us, carers are patient, warm, and empathetic. So I know there's a list there of what some carers have reported to us that we've collected over time. We know that no one has all the answers. For us, great carers are open to learning, sometimes everyday learnings and on the run. We see great carers are people who are willing to ask for help, so they know when they need help. They are willing to be members of the team that we at Life Without Barriers build around the young person in care, so we call them care teams. We see great carers as being curious and want to know why children do what they do. Another way I look at it is having a sense of wonderment about a child. So I wonder why they do that. How can they do that? I wonder what's going on for them right now. Those kind of questions are really great ways of getting to the heart of what's going on for children. So that's what we need carers for. It's really important to know that caring for children in care is quite different from parenting your own children. Having time and space available in your lives and hearts to be able to provide all the attention and attachment that a child needs is another key to being a good carer. We know that families, like I said earlier, will always be important to children. So really having appreciation of preserving those relationships between a child carer and original family, we know that will be the best, so sticking with that. Great carers are opening to knowing families and support children to explore their own family connections and stories creatively, even if they can't see each other. So keeping those memories alive, especially the good ones. So, and most families, even though they come under the attention of the department, there still is some fun, happy times. So it's good to kind of be able to work with kids and remind them of that. Great carers have an underlying belief that all children can achieve great things, and the right supports, environments, and people that believe in them. Great carers know that everyone has their ups and downs and are there on the tough days and the good. We look at great carers as being compassionate, flexible, and also fun. Sometimes that's what we need to have with kids, is having fun and joyfulness with them. You know, some kids have never had that. I've been working in the sector for nearly 30 years, and you know, you see kids who've never had an adult smile at them when they're 2 years of age. So that being able to really express joy with them when they do achieve great things, although it may seem a bit weird for us, it's fantastic for them. So what do we got next? So I've talked a bit about that. All right, so who can be a carer? So for us in Victoria, because every state has their own legal side of who can be a carer and who can't. So we look at carers as being single or in a partnered relationship. They can be without children or have their own children. We want carers from all backgrounds, so all cultures, faith, beliefs. So for us, you must be over 21. And we also ask you have relevant life experience. So that may be that you work in childcare or you're a teacher. Another great one is we have single carers without children who come on board who have nieces and nephews or friends who they've been involved with the children since they were born. We need you to be well and healthy to ride out the hard days, but also jump for joy. I need you to jump for joy and be happy with kids. Having a regular source of income is really important for that stability. I said before, culture, faith, sexuality or gender identity expression, want them all. single or in a relationship. The other is really be willing to undergo background checks. So we have an obligation to make sure that, people don't have any police or criminal history involving, especially things related to children. So as I said, with or without children, you can rent or own your own home. So it can be private, it can be public housing. You definitely have to have a spare room in your house. And that is around children, one, having respect and dignity. So I'm sure if you go somewhere visiting, short stay, long stay, you really value and appreciate having your own space. So it also helps for a young person coming into care to feel that they're welcomed and belonging. There'll also be times when they may not be coping very well with their grief and loss or with their trauma background. So they need a space that they can go to. So they may need to withdraw for a period of time. So one of the things we have been looking at is a car and a license. So if you are someone who doesn't have a car or doesn't have a license, please still give us a call. We want to be able to really have a conversation around how you could support a child in cases of emergency. There might be lots of transport to and from appointments. So we don't say you necessarily have to have it, but it is, so it's not essential, it's desirable. But please don't, if you haven't got a license or a car, don't stop you from giving us a call. And then everyone being active and willing is great. All right, what we got next? So to become a carer. So really, if you've liked this and you've gotten enough information or you want some more, we'll do some questions at the end. But really it's about contacting our teams or our inquiry team. You'll get all this information on how to do that in the chat at the end. And you'll also get a follow-up email, usually the next day, 24 to 48 hours, which will give you all this information. It's a good way to talk to our inquiry team. So any questions or that don't get answered tonight, or sometimes you might realize you had a question within 5 minutes of this ending. That's always annoying. So it's good to have that opportunity to ask any questions. Our inquiry team are all highly experienced within assessing foster carers. So they're pretty good at answering your questions. So they'll take you through that initial phone interview. And really it's looking at, is this right for you? And is LWB right for you? It mightn't be. Once we get the inquiry that comes down to us in Victoria, we organise a home visit. And because of great COVID, we've now been wonderful at using Zoom, like these webinars. So most of our initial home visits with you will be via Zoom. And it's talking through making a formal application. And it helps us all to get started on to those background checks. So the police checks, national and international. So it gets us through those, and the working with children check, you need to have one of those. So once we've gotten through all that, we then go through training. So training is mandatory in Victoria. It's the shared lives training. It's 8 modules. We do it over a couple of Saturdays and a couple of evenings, always kind of mixing it up a bit. It really gives you a lot more information about what the care system is like, a bit more information and education around children in care, and how best to be able to care for traumatized children. Once you've gone through the training, you'll then go through an assessment. So an assessment, another area, it's called Step by Step. It's mandatory in Victoria. So we have a number of assessors within Life Without Barriers. We also do some contracting out to agencies. And that consists of about 4 to 5, maybe 6 separate interviews that average about 2 to 3 hours each. So it's a time where we speak to you and all household members, including your children. So, and we do that in consultation with you. So it's really about assessing your competency and capacity to be able to provide that quality care for children in foster care that the Victoria government asks. Once the assessment is finalised, you get a nice big report comes up and you get to read it. It will determine whether we are recommending accreditation, and it'll also go through your placement times. So it's really about showing that you're a good fit as a foster carer. And then we go then to a panel in front of representatives of the department who then accredit you as a carer. And then we go through a whole induction onboarding, and within 4 weeks after that, you're going to take some placements. You'll always get us knocking on your door for if you become accredited with us. All right. Gosh, I've done well tonight. So we're going to go through some most frequently asked questions. So as I said at the beginning, we've come up with those frequently asked questions we get all the time, but please continue to put questions in the chat and Louise will monitor just in case we haven't, because we can't think of it all. So it'd be good to hear some really good creative questions from yourselves. It always gets us thinking. All right, I am single, can I foster? Yes. Families come in all shapes and sizes. Children come from all family shapes and sizes, and so do foster families. So single, in a relationship, it doesn't matter. Part of the assessment will be to look at, as a single carer, what supports you have available around you, because it's tough at times. So we are a same-sex couple. Can we foster? Definitely talked a bit about highlighting in the past around diversity is really important for us. We also have a number of young people coming into care who are really grappling with gender identity. So, excuse me. So having carers who've gone through their own journey would be great to match them up, and also to educate us a bit more. That'd be great. Can I foster even though I don't have my own children? Yes, I talked a bit about that briefly before. It's about having experience of interacting with children, and that can be gained in many ways. So childcare worker, we have sometimes nurses, disability support workers who have great experience working with children with complex and disability needs. So they're just as great as being foster carers, even though they don't have their own children. So it's about going through the training, giving us a call, going through the training process, and then allowing us to work with you in assessing your capacity and what fits best for you. Do I need to have a spare room? Definitely, definitely. We can't have young people who are in care, children in care, sharing a room with other children, so your own children. They really need to have their own space. Occasionally, with approval from the department, if it's a sibling group of 2, maybe 3, they can share a bedroom, but that always has to be decided by the department. We kind of look too, if you're looking at moving your own children to another room in the house, or whatever the arrangement is to make a spare room available, is, do that in consultation with your child. It's really good to have them on board as well. And try to do it before any young person arrives in your home. We'd hate to think that your own child got put out or upset, and then you've got the animosity between children, which is not great, and that's not going to be helpful for a young person in care healing and thriving. Do I have to own my own home to be a foster carer? No. What you need to demonstrate is that your home is stable, safe and suitable. So renting public housing, paying off your home, or owning it outright. We kind of look at if major things like renovating your home is going to happen in the next 6 months, maybe put off the idea of fostering. So any of those major changes, things like if a couple are deciding to have a family, we may say, that's a priority, come back to us in a few years' time. So any of those major things that will impact on your time and capacity. Can I have my own children and foster other children? Yes. In the assessment process, we look at considering the ages of your children, their needs, how you would manage it all, a child in care and their needs. So generally speaking, when we place children with foster carers who have their own children, we look at the child in care being younger than your own. And that could be, I mean, generally it can be around behaviors and the impact, but you know, we still want your own children to have their own status in their own home. That's really important to them. Will all my family be involved in the assessment process? Yes. So every household member would be part of the process. Especially every adult has to go through and consent to police checks, and also having a working with children check conducted. Your own children will need to be part of the assessment and be interviewed. So it's really good if you have your own children to really start talking to them about that. You need them on board. Lots of times if you know, teenagers, they have a great sense of support and loyalty for their own parents. So that can be really great too with younger kids in care, but you know, we want to make sure they're not put out. And of course, you as parents wouldn't either, but it's just an area that we really want to push. How are children matched to foster carers? So basically it's about us getting to know you. So especially through the assessment process, it's part of the conversations we have is to ensure children are matched to carers, and the supports about the need, what the needs of the young person is, what's your capacity. And also it's about, you know, wanting to have a good fit for your family as well, but it will all be made in the best interests of the child. Can I choose the age and gender of a child? So our assessors will work with you around that best fit. So, you know, the good fit for your family, we're considering your skills, household dynamics. Like I said, we want the young person, child in care who comes to your home is younger than your own children. But if you really narrow down your specific preferences regarding maybe age, gender, that can be really difficult to have a good match. So, but like I said, the assessors will work with you. Usually it's about, you know, not carers will say it doesn't matter whether it's a boy or a girl, but maybe it's primary school age, or maybe for all you people there are going to sign up to foster teenagers, keep them out of resi. So you might be saying, you know, 14 to 17, yes, I'll have them. So it's all about the assessment process. That's why it's like these 4 or 5 separate interviews that can go for 2 or 3 hours, because we need to get to know you. We need to be able to make an informed decision in consultation with you. You'll also get to know stuff when you go through training. So you may have a thought in mind now, but it may be that training opens up a different thinking around that. Do children in care have ongoing relationships with their children? Yes, in most cases they do. It's determined by the department, but we know maintaining those connections, regardless of what it looks like, even if it's phone calls, even if it's cards, it's really important though, and the best long-term outcomes for children. We work in a care team that will support you around that. Okay, what happens if placement isn't working out? So stability that we know for children to be able to heal and thrive is really important. It's not in children's best interest to be moved around continuously. That only compounds their trauma. It can also compound the sense of loss and grief. So we really need resilient carers who are able to work with our care team to push through those hard days. If ending a placement does have to happen, and we respect that, we will be there to support you and the child. But it's also good if children do have to move on, if we as adults can really do good goodbyes for them and not have it end abruptly. And they're sitting there with the unknowns. And I'm telling you, kids in care, they always feel like it's their fault why they came into care. It's their fault they got separated from their siblings. And then if a placement abruptly ends and they don't have any of the reasons explained to them, they'll think it's their fault. Hence why they won't do well and thrive. It just makes it harder and harder. So assessment. So I keep talking about assessment in terms of looking at placement types. So it's a real important step in making sure your home environment is going to be safe and nurturing for a child. And also to assess that you and your family are ready to take on the role as foster care. Usually takes up to 6 months from the time your first inquiry and the application gets done. But it can depend on differing circumstances. So sometimes people start the process, they get through to training, and then they just ask to go on hold. Something happens, that's fine. We're happy to work around that. We also want to make sure you're making really good informed decision and choices. So we have a program that's called Nurturing. So even though you may stop the whole process, you get part way, we have a nurturing program that kind of keeps you linked in. And when you're ready, you can always come back to us. All right, support. Okay, I'm going to list all these. Okay. Life without barriers for us. I talk about a care team. It's also about, we really want to emphasize and get across that you're never alone in your caring journey. It can be difficult understanding what a child comes with. Sometimes, especially emergency, they can come into care and we know nothing. We don't have the Medicare card. We don't have birth certificate. So trying to understand children's experiences when you don't have all the information can be really frustrating, not only for you as foster carers, but also for the child. So it's important for us that carers feel supported and confident when they're supporting a child. So we have the shared lives training, but we also have ongoing training. So once you're accredited, you have a care team, a case manager. We have lots of training available online on our internet. We also link in with other training. So sometimes it's Zoom. We're getting a bit more face-to-face. And you work with your case manager, care team, what particular areas of training you may need. It could be in response to a particular child, or it could be a general. We have 24/7 on-call support. So those times where you need some direction or you need some guidance, you have access to that number all the time. Financial support is via foster care allowance. So that is to accompany the young person in terms of their need. At some and it'll have to be your own circumstances, may be able to access Centrelink and family assistance. We do have some specialist support in terms of specialists to help out with the really tough kids that you've tried and tried and tried. So we have that kind of support around behaviour support. Talked a bit more earlier on about respite. So if you are a short-term, long-term carer, you will be supported with ongoing respite. And then we have carer networks. So we have a variety of catching up with new carers, with old carers. Right now, a lot of them are done through our national. So you get to meet those carers in Victoria on Zoom. And also nationally. We're now, with coming out of COVID, are trying to increase a bit more catch-ups because sometimes the only people who really get what's going on for you is talking to other carers. All right, Louise, was there any questions from the chat box that we didn't cover?
There certainly is some great questions, Elizabeth. Okay, we'll kick off with this one. Okay. Where do the children stay while you find the foster parents?
They said with other foster parents. So I suppose when the department determines they need to remove children and they've gotten a court order, be it temporary, emergency, they put out a referral to every fostering agency within the division. So we need to keep children within the areas that they're removed, because that's about connections. And, you know, if they're under emergency care and they've just come in, we want to keep them at the same schools. So, I mean, they could be going into resis temporary. They could be going into, I know in other states, I'm not quite sure Victoria, I think they do, is sometimes we have to put them up in hotels with support workers until we get foster carers. So it's always a last option. I spent 10 years with Child Protection in Queensland and was on the investigating team for 5 years. So removing kids is always a last resort, because we don't have a plethora of foster carers to knock on. But and that's what, and if we have to remove children, it's always trying to find family as well. Hope that was the best answer I could give you.
Okay, I feel there's big needs for emergency care. Do we have enough supplies for that? And just to save children becoming homeless, what is the process for offering emergency care, and is there a supply income to carers? So basically, is there enough need for emergency carers? I would take that as.
I would say yes, there is a need for emergency carers. Like I said, it may be, you know, children being instantly removed, or it may be with a full-time foster carer needing to go interstate for a family emergency or some kind of emergency. So the fostering allowance comes with a child and is in response to the needs identified. So at an emergency time, if they don't know the child, it'll be that basic foster care allowance. As the care team or the department gets to know a child, the needs are identified. So, so the foster care allowance is commiserated to that need. Did that answer that question? It was, I mean, the need is great, you know, so I wouldn't say no to someone just putting their hand up for emergency care.
Are there COVID vaccination requirements to be a foster carer?
Okay, it's a really good question, because when I came to Victoria last year and commenced working with Life Without Barriers, it's a real hard one for me to get an answer. So our funding body, the department, is not mandated that you have to be vaccinated. The department says it's best if you are. For Life Without Barriers, you don't have to be fully vaccinated. But so we do take on applicants who are not fully vaccinated. However, the proviso is that direction could change anytime. So if it changes and you're not vaccinated and you're an accredited carer, you may be asked to leave. The important thing with vaccination is that a child coming into care has to have all their vaccinations, regardless of it's COVID. So, you know, babies and toddlers. So even though you may decide not to get the vaccination for yourself, we need carers who will support children and young people having their vaccination. So yeah, but it could change. Like I said, we don't at the moment, but it could change anytime.
Excellent. Thank you, Elizabeth. You've already touched on this one. How long does it take to become a foster carer, assuming that everything's okay?
Yeah, it's around 5 to 6 months to go through the full process. If everything is okay and you do all the paperwork that Louise will ask you to do, you'll have some paperwork, like you get homework tasks in the assessment space, so it's availability for those appointments. Then it's reading the report pretty quickly. We send a package. Once you've said it's all okay and I've said it's all okay, it goes to the department, and really within a week and a half, we've got panel, and and you're accredited, then it's an onboarding process that takes about 4 weeks. So hence the 6 months. Yeah.
Right. I'm currently working with a child who has a trauma background. I found it quite stressful, and I do worry about that, as I would love to be a foster carer.
So the worry is having to deal with it at work and then having to deal with it at home. Is that what we're assuming?
Yes, yes, I would take that.
Yeah. Listen, we'd love to have a chat with you, especially with the skill set you would have. I suppose the difference I would see is around the care team that you have available. You don't necessarily, even though you have a skill set, you don't necessarily have to, you wouldn't be forced to sign up as a foster carer to take on a child with complex trauma. Yeah, I mean, it still would be stressful. It's stressful being a foster carer, regardless of what you're doing at work. But we hope to think that as a care team in Life Without Barriers, we're able to support you through that. That was a really big question.
You have a team 24/7. Okay, how do I become an emergency house, and what is the process?
So emergency care is really going through that process of following the information that you will receive in the chat, but you'll also get that email in the next 24, 48 hours that guides you through the next step. So it's really calling our inquiry team, and they'll talk you through the process. And really it still takes up to 6 months if everything runs smoothly to get you through to be an emergency carer. It's no different whether you're going short-term, long-term, respites, all the same.
It's the same process, yeah.
Yeah.
Okay. Told you there's some great questions. If the potential foster carer is on a specific diet, as in no meat, can they be matched with a child of the same diet?
Okay. All right. So it's possible. The dilemma for us is that you really limit the pool and the chance of you being asked to provide a safe home for a child. So I can't statistically give you the numbers of, you know, how many children coming in who have special diets or religious or beliefs. So it's just like I said earlier, if you limit ages or gender, and the same with dietary, religious, language, it lessens the chances of us actually supporting you in being an active foster carer. So it's about, if we're not asking you to change your diet, but it's about whether you would support a child with having their diet. So some people can be very black and white and not allowing particular food groups within their home at all. So that may limit your capacity to be supportive and welcoming of a child in need.
Absolutely. And that is it, Elizabeth.
Oh,
Great.
wow. What time is it? What time did I get to? I've lost my time. Fantastic. So that's it. I've seen how the numbers creeped up there. We started with just a few and it creeped up. I hope all these that joined a bit late got some kind of understanding of this presentation. Please, if you have any other questions, just follow up with the information that we'll put in the chat, but also in that email. Thank you so much for for joining us this evening. I always love doing these. I hope you enjoyed it and I hope you got something out of it. So thanks so much.
Can I just mention, I've just popped in the chat, everyone, a link. So if you do want to call back to ask any more questions or queries, click on that link and someone will get back in touch with you.
Fantastic.
All right.
Thank
Good night,
you, Louise.
everyone.
Good night. Thank you.